Hello, everyone, and good afternoon. Thank you, everyone, for being here, and thank you to our speakers as well. The GHI at AUB, the Global Health Institute, is organizing this webinar today as part of its ongoing campaign for Refugee Week 2020. Under the title of our campaign, Magnifying Vulnerabilities, this webinar will address refugees living with disabilities more specifically, and will review case studies and on-the-field experience from both of our speakers. For everyone listening, GHI works on several projects with various factions of the refugee community in Lebanon and the region, and this campaign indeed falls directly in line with this work. You can follow the Global Health Institute at AUB across all our social media platforms, as well as our official website for the rest of our Refugee Week campaign, as well as our upcoming events, research, and activities. And in order for us not to delay our time a little further as attendees roll in, I'm going to take this opportunity to introduce our first speaker. Dr. Emily Kombaz is a researcher and consultant in social sciences with over 15 years of experience in academia and practice policy-oriented settings. She focuses on human rights, gender, aid, and international organizations, and has extensive experience providing research services and advice to support large and small aid organizations in their policies, programming, practices, and training. She authored several reports on disability, including one for the UK's DFID on the situation of persons with disabilities in Lebanon, of which she will be sharing the findings with us today. She earned her degrees, including her PhD in political science from Sciences Po, Paris, and France. Dr. Kombaz, thank you so much for being with us today. I'll give you the floor.
Thank you for the introduction, Dana, and welcome everyone. I'm delighted to be here. So let me just share my screen. I have a PowerPoint presentation for you today. So I'll just be starting from this today. All right, so as Dana mentioned, I'm going to be talking about Syrian refugees with disabilities, and specifically, I'll identify the main issues sorry, I'm just going to reduce the main issues, the key factors at play shaping their conditions, and pathways to help empower them. If there's one message you take away from my talk today, it should be this. Public, private, and non-profit actors that have been supporting Syrian refugees must simultaneously take better into account and better address the severe problems that affect specifically Syrian refugees with disabilities. And at the same time, when they do so, they need to better build on the capacities and agency of these refugees, as well as others with disabilities in Lebanon, because Lebanon has a very rich history of mobilization by persons with disabilities themselves, dating to at least the Civil War. And, you know, there's a lot that could be drawn on from more by, for example, international aid agencies in this. So why is this an issue? Why are we talking specifically about Syrian refugees with disabilities? Obviously, the first thing is this is a human rights issue. So, you know, it matters in and of itself. Now, specifically in the Lebanese context, the situation of Lebanese persons with disabilities is already bad. So the starting point in the country before 2011 was already really difficult for people with disabilities who are Lebanese. Similarly, the situation of refugees in the country was already difficult, as was the situation of migrants, including migrants who are caregivers for people with disabilities. And lastly, the situation of persons who are disadvantaged in other ways by structures of inequalities like class, gender, age, and race is already not very good in the country as well. So what this means is when Syrian refugees with disabilities started coming into the country in 2011, the material and immaterial support for their rights was already lacking. Not entirely, but it was already very weak. And so what this means is Syrian refugees with disabilities find themselves at the intersection of multiple discriminations and also multiple failings by public, private, and non-profit actors. I'm not saying all these actors are failing across the board, but there are serious deficiencies in the support provided to persons with disabilities. So now, what do we know about Syrian refugees with disabilities? The basis for my talk today, as Dana mentioned, is a desk-based literature review that I did in 2018 that was commissioned by the UK's aid agency, the DFID, and it's freely available online. I'm putting the link here in the presentation. So I reviewed academic, practitioner, and policy publications for this report, and I reviewed publications in English, French, and Arabic. And as a complement to prepare today's presentation, I looked at any new publications that have come out since that report in English. I didn't have time to do it for French and Arabic, but I think I covered most of the bases there. So what do we know? What's the state of knowledge and research, whether it's coming from Lebanese sources or foreign sources? Well, unfortunately, there is still to this day limited research and knowledge on Syrians with disabilities. There are also problems with the reliability of data coming from government sources on disability in general. I can speak to that in the Q&A if you'd like. The good news is there are a number of high quality studies that we can draw from to draw conclusions. So let's start with prevalence. What's the prevalence of physical, sensory, intellectual, or mental disabilities? Everything I'm going to tell you now are really rough estimates because there's a lot of issues getting data, but let's get a general sense of the different population groups that we're looking at. For the Lebanese population, it's estimated that 10 to 15% of people have some sort of disability. For Palestinian refugees, it's about 10%. Now, for refugees who have fled from Syria since 2018, it's somewhere between 10 to roughly 23%. Now think about this. If you're working for any kind of organization supporting Syrian refugees, this means 1 in 10 or even 1 in 5 person you're going to be interacting with has a disability. This is massive. So, this is really something that needs to be taken care of and taken into account. The figures for Palestinian refugees, Palestinian Syrian refugees, are really hard to get by. One I found was 8%, but it's also likely that it's higher in some settings. But that's the general picture of prevalence. Now, if we break this down by age and gender, which you should always do, you should always disaggregate your data as much as possible. I'm not going to run you through all the details of the figures, but basically, this is from an Australian study that was done with 2 other NGOs or organizations in 2018 in 2 different settings, 2 different camps. What they found was, in this particular instance, there's a greater rate of disability among boys and men between the ages of 2 and 34. And then from 35 years old, the rate of disability is higher among women. So I don't know if this is replicable at national level, but I think it's really interesting to be aware of the existence of these differences. Similarly, that study found that, for example, different age groups are affected by different functional disabilities. So again, I'm not going to run you through the details, but this is really important because it means different groups and different genders may need different priorities and different types of support for their respective disabilities or functional limitations. So in practice, when you look at daily life, what major problems do Syrian refugees with disabilities experience? The overall view is there is widespread discrimination, marginalization, exclusion, and violence. It's a really bleak picture, and this is something they experience at the hands of a range of state and non-state institutions and individuals. And those problems can occur in the home and outside the home. And this really applies to all areas of their lives. So in particular, there's problems, major systemic problems in their access to work and also access to basic services, health, education, social protection, in particular, sanitation, water, food, etc. So work and basic services are typically scarce for them. They're not accessible. And even if they're accessible, they're often of poor quality compared to their needs. So this has resulted in a situation that's been extremely detrimental to the rights, capacities, experiences, and quality of life of Syrian refugees with disabilities. Now, when we try to compare what they experience with the experience of Syrian refugees who do not have disabilities, now in some areas, it's actually fairly comparable. So, for example, 77% of Syrian refugees with disabilities do not have legal residency permits, which is a really high rate, but it's actually fairly similar to Syrian refugees without disabilities. In a few areas, there have been improvements. So, for example, 94% of Syrian refugees with disabilities had access to a sanitation facility that was adjusted for disabilities according to the latest UN figures. And this is an improvement over, 3-4 years ago. So, this is a bright spot. However, most frequently, the problems that they experience are markedly worse in terms of degree compared to Syrian refugees without disabilities. And if you want, during the Q&A, I have a few examples of figures on health services, water, food, school enrollment for children with disabilities. And I'll just give you one example here, which is work. 15% of Syrians with disabilities were working, whereas, nearly 27% of those without disabilities were working. And the figures are even worse among women. So, it was 4% of Syrian women with disabilities versus nearly 8% of Syrian women with disabilities, without disabilities working. In all cases, these are bad figures, but they're clearly worse for those with disabilities. So why is that? What's going on here? What factors are shaping their lives and experiences? Now, the overarching finding is that there's a systemic lack of provisions for the rights, resources, and services needed by persons with disabilities, including Syrian refugees with disabilities across Lebanon. So basically, the starting point is one where people with disabilities are disadvantaged, and then Syrian refugees have it even worse. The key reason, the major reason before that is inaction by the state. So there are a few key factors here. First, the legal framework on both disability rights and refugee rights is limited to begin with in Lebanon. That small existing framework is not enforced, it is not implemented and enforced properly. And then both legislation and policies have failed to embrace a rights-based approach to disability, and instead it's relied much more on an outdated medical model of disability. But this is, so this is the key factor here, but there are some more. In the state, but also in society at large, there are other problems. One is that actors in formal politics have taken little to no action for disability rights. Another is that even in society at large, even in intermediary institutions, approaches to disabilities often rely on charitable or medical models of disability rather than rights-based ones. And this leaves gaps for people with disabilities. There are also, a common lack of knowledge, prejudice, and stigma that remain against people with disabilities. And I really want to emphasize this. This is a particular issue for those with intellectual or mental disabilities. This is a very strong case there against these two particular groups. Moreover, family caregivers, who are usually women and girls, also experience a very high burden of unpaid care work. And in turn, this negatively affects the people with disabilities that they care for. And also in the broader context, hostility that exists among parts of the Lebanese population against Syrian refugees also applies to Syrian refugees with disabilities. Another set of factors is that international aid actors have also neglected disability. They came to this very late. So there were several references, even by these agencies themselves, that acknowledged that basically until 2016, 2017, they hadn't really paid attention to this. So they're now playing catch up. And so for everything that I've just cited now as factors, the lack of effective remedies has led to impunity for these failings. Basically, if you don't care about disability, there are no consequences for you if you're in a decision-making position, in the state, for example. And the final thing is you should always keep in mind intersectionality of inequalities. So, for example, poorer and less educated Syrian refugees are worse off. As I mentioned, also people with intellectual or mental disabilities are worse off than those with physical or sensory disabilities. I'm painting this in broad brushes, but just giving you key findings. Women, girls, and boys in terms of gender are particularly disadvantaged. Similarly, in terms of age, children, youth, and older persons. And then Palestinian Syrian refugees are in a particularly difficult situation. However, there are also ways to do fine-grained analysis that take into account not just vulnerabilities, but also capacities, and they can give you really interesting insights. And this is going to be my final 2 slides, so I can stick to the allocated time. What are ways that you and your organizations could support and empower Syrian refugees with disabilities? I'll start with an example. There was a set of publications that actually looked at the risks of gender-based violence, sexual violence, early marriage, domestic violence against Syrian refugees with disabilities. And it was really interesting because it made a point of looking not just at vulnerabilities, but also capacities. And its findings were very, very interesting because they were very precise, very nuanced, and they offered a lot of opportunities for action. They showed some protective factors that go beyond very general ones like, well, the poorer you are, the worse off you are. That's true, but is there anything else we can learn? And so, for example, this set of studies showed, having strong family support systems is supportive, a steady economic situation, good access to services, but also things like solid peer support networks for the person with disability and appropriate assistive devices like hearing aids or walking canes that remove certain disabling barriers helped protect against gender-based violence. So when you do this, analyze capacity, not just vulnerability, and look for resources, skills, and assets, not just problems and weaknesses and deficiencies. And so this ties to my concluding general point, which is I would really encourage actors to shift from a focus on deficiencies and problems, which tend to invite a charity response, to a more balanced attention to both problems and resources, to vulnerabilities, but also capacities and agency, which invites a more rights-based response. And if you want to do that, you might be thinking, okay, that sounds great, but how do I do that? There are actually a few good practices and toolkits that are available that have been tested in the field. So there are links in my presentation to these. And I also want to conclude on 2 things. One is you still need effective institutions across the country to work well for everyone, because there's no way you can serve Syrian refugees with disabilities well if you don't serve everyone well with good public services. So this means your work should also have a component of advocacy and activism, whether it's public or private, done quietly or not, but you should do it. And as I said, in conclusion, really build on the rich history of inclusive, rights-based, transformative activism by persons with disabilities and their diverse organizations in Lebanon, and call on them not just on disability issues, but also on public interest issues across the country. They have a record of having excellent points and mobilization capacity on this. So I'm going to finish on this invitation to turn to local partners.
Thank you so much, Dr. Kumbas. Thank you so much for your time. I do agree with you. I believe the word intersectionality is the word of the day and the word of the year. At the moment, we do approach groups of refugees as a homogeneous group, and I think we're slowly deviating away from that. And we hope that GHI will fill that gap as well in the research. For everyone listening, I'd like to as well divert your attention to our Q&A section. So if you have any questions for Dr. Kumbas, please type them. And after our second speaker finishes, we will direct questions at both speakers. So allow me to introduce our second speaker today, Rita Flora Kevorkian. Rita serves as the Associate Protection Officer at the UNHCR in Lebanon and has been working at UNHCR for over 13 years. In previous capacity, she serves as the Community Services National Officer, as well as the Senior Community Services Assistant. Rita, the floor is yours.
Thank you so much for today, for organizing this very interesting webinar. I also would like to thank very much Dr. Kumbas, because the points that she was raising, particularly moving from a charity-based approach towards a more rights-based approach, changing a little bit the perceptions that we have towards this group of, we still call them persons with disabilities, but nowadays we're shifting more also towards moving this perception by calling persons with abilities. Because why would we want to limit one's abilities to, you know, certain challenges that they are facing? And the other thing is, another core element that she mentioned is the whole concept of inclusion. We need more and more inclusive approaches rather than only looking into this particular group as a group that would only need specialized services. Anyhow, so going through my presentation, I know I have around 15 minutes before we go into the Q&A and the more interesting part. But let me give you a little bit of the background of when we talk about persons with disabilities, refugees with disabilities, what is it that we mean? What are some of the programs that are in place, some good practices, and the way forward? Just very roughly, a quick overview. Around 4.2% of the refugee population known to UNHCR are basically persons with disabilities, and here we're talking about around 37 plus or minus thousand individuals. 2/3 of refugees with disabilities are male, and 1/3 are female, and over 1/3 are children below 18 years old. For UNHCR, how do we identify persons with disabilities? Through 3 channels if you want. The first channel is when a person approaches our reception centers. We have our specific identification methods, including something called the Washington Group of Questionnaire that we ask to families just to identify if there are any individuals with disabilities, and just to make sure that we're also capturing the right type of disability, because there are also misunderstandings on that front. We also identify refugees with disabilities through our partners that we work with across the country. There are more than 30. And sometimes, because we have a very robust community mobilization structure, we also have referrals from communities, from the refugee community, referring to us individuals with disabilities who either have capacities that we can engage in our existing programming, or maybe they have specific needs that were not addressed, or no one looked at them and they need particular support. I mean, in general, I mean, if we want to go very quickly into the types of disabilities, those who have hearing impairments are the highest known to UNHCR. Then those who have moderate disability, mental disability, severe mental disability, then we have moderate physical disability, severe speech impairment, visual impairment, and we have a big chunk of undetermined types of disabilities that we're also trying to clean and clear our data. Because at the beginning of the crisis, particularly, there were many that came saying, okay, they have members with disabilities in their family, but they couldn't bring them with them. They didn't know that they should have come, etc. So there were some data missing that we're still trying to identify. No, there's no slide for the second presentation. I have to be a little bit more interactive. I'll try my best. One important element to consider is that if we say that persons with disabilities represent normally 15% of the work population, then we also need to admit that there's a little bit of underreporting when it comes to refugees with disabilities identified by UNHCR. We try to engage with disability and older age working group and to find an explanation to this. And there are many assumptions that maybe many persons with disabilities, they have stayed in Syria and they weren't able to move due to mobility issues. Some refugees with disabilities, mainly those with mental disabilities, may have not been identified due to underreporting. Further barriers to identification of persons with disabilities. They also show the need to enhance the overall, capacity of staff working in the humanitarian field to better understand disability-related issues. These are things that we need to take into account. Another element that is very important as well, I want to discuss a little bit about the protection problems faced by refugees with disabilities, which Dr. Kumbas explained, and I believe when she mentioned whenever we look to any population, it's good to look at them in terms of age, gender, and diversity. I would say that we, as UNHCR, we conduct participatory assessment sessions, or if you want, structured communications with our population of concern systematically and regularly. And persons with disabilities also, we make sure that they are consulted, this group is consulted, whether they were children, adolescents, youth, adults, etc. Most of the problems that they face is basically, they face a lot of physical security problems. Because they are persons with disabilities, there's this perception that they are easy to bother, easy to harass. They face a lot of physical harassment. Some of them face sexual abuse and harassment, whether from the community they live in or from the hosting communities. Most of them, they find challenges in integration, in being accepted, in finding decent work, particularly as well as it was mentioned earlier, because already the national system is very weak and already there's no proper programming or proper strategy, if you want, at the national level for persons with disabilities, including Lebanese. So basically refugees, similarly to Lebanese, but also double because of their situation, because of their legal condition, they face immense challenges. So there's the cultural issues, stereotyping, stigma towards persons with disabilities. Of course, it hinders them from accessing services and activities. They're often perceived as second-rate or second-class citizens, if you want. Access to schools, there are some schools where they immediately say, okay, they need a specialized school, but no, not every child with disability would need a specialized school, you know. You also have integrated programs. You also need to make sure that the minimum in terms of physical accessibility, then in terms of programming, etc., that is available and open for everyone. Of course, this misconception that persons with specific needs or persons with disabilities, they would need specialized services all the time, where this is not always the case. Of course, I mean, this leads to further marginalization of this group, and this leads to further exposure to protection risk. If a child is not at school, then the child is either in the street or moving around tented settlements the whole day, and then you never know what happens later on. Also, there's another perception that, you know, children with disabilities would definitely need to be institutionalized. So as you know, in terms of child protection in general, globally, we're moving very much out from this institutions to family-based care, to help the families to take care of the children or of the adults, giving them necessary support, giving them necessary knowledge, the life skills, tools, etc., to take care of their family members with disabilities. And particularly, Dr. Kombaz also mentioned the issue of the caregivers. Care for caregivers is another thing, because we know how much energy and how tiring it can be to take care of particular groups that require all day long attention or particular medical support. So care for caregivers should be also part of our programming, which is not necessarily nowadays. Now, for persons with disabilities who would need an institution, basically everything is very much privatized in Lebanon. The capacity is very limited. And if a refugee with disability, because of a certain medical condition, would need institutionalization, it's extremely expensive, it's not accessible, and because of the limited space, etc., it doesn't really help us much. We have physical accessibility issues in terms of most of the services. They don't consider the specific situation of persons with disabilities. You don't have proper ramps. Not all the schools are accessible. I don't know, public transport, it doesn't even exist. But even when it existed a few years ago, it never considered the particular requirements for persons with disabilities. One thing to say is that when we talk about considerations, it's not something extra that we are asking from the system, from the government, from organizations to do. This is part of an inclusive approach. This is part of making sure that each and every individual has access to their rights according to all the human rights concepts and rules and regulations and frameworks, etc. Again, this is not something special. This is the minimum. This is a requirement as humanitarians that we need to make sure that we have these things in place. And again, just to say that national and institutional barriers also exist. The national system is not equipped to respond to the need of persons with disabilities. There is no national strategy at the ministry level to deal with persons with disabilities. I know that something is now being developed and by UNFPA and the Ministry of Social Affairs, but it's still not out. All these years we never had anything, but I mean, there's some movement happening. The fact that there's no common vision and common strategy, it also creates a disharmonized approach on dealing with persons with disabilities, and really, it doesn't help to acknowledge or to address gaps. You know, sometimes we also think that, you know, most of the services, particularly before the Syria crisis, they were all based in the capital, in Beirut. It is, or in particular areas, and it's very much, you know, these institutions are either very religious based or, you know, or community led, where, you know, sometimes in terms of standards, in terms of operating procedures, we see discrepancies. We see discrepancies a lot, and in terms of accountability, who holds these institutions accountable if they're not supported? You know, if they're not monitored by the state, or, you know, at least by whoever is supporting these institutions. In terms of intervention, UNHCR has 3 levels of interventions. The first level of intervention is at the individual level. As I said, we provide individual support and counseling, what we call as case management support, to persons with disabilities and their families to be able to, to be able to address particular issues that the family is facing. Of course, we also facilitate access to services. We try as much as possible to link with existing national services, but because they are very weak, in terms of the humanitarian community, we also see the need to complement these activities, the existing national activities, with additional ones to cover the gaps. Again, going back to what Dr. Kambaz was saying, we are very lucky in Lebanon that we have very strong civil society. We have disability-led NGOs. I have to mention at least two of them, which is Arc-en-Ciel and LPHU, among others. They do amazing work, they advocate a lot, but also at the same time, they also need the support of other organizations, because working on disability issues is not, it's everyone's work. Even if as an organization, I don't do specific programming on persons with disabilities, but we still have the obligation to mainstream disability in other existing programs, even if they're not focused 100% disability oriented. And the whole issue of inclusiveness. So this is at the individual level. When we say access to services, they range between educational activities, health, mental health, community participation, and most importantly, community engagement activities. In terms of activities as well, I guess it's very important to mention that, yes, we do need specialized programs designed for this particular group, but at the same time, the whole issue of inclusiveness should be very seriously taken into consideration. The second level of intervention, if you want, as UNHCR, we have a range of more than 25 community development centers. These are safe spaces where anyone from the community can come to benefit from activities and services. And there we basically have, and persons with disabilities have access to these services. In some areas we have committees, particularly looking at disability issues created and composed by, comprised by persons with disabilities. We also have a big number of the so-called outreach volunteers. These are people from the refugee community who are trained to identify persons with specific needs who are not being supported. And among them as well, we do have persons with disabilities who are mobilized to identify other individuals who have either the same, similar, or worse situations. The profile of those with disabilities engaged and who are, volunteer with us, they mostly have physical disabilities caused during the unrest, during the war in Syria. But also we have those who have hearing impairments, etc. So we try to engage as much as we can. Is it challenging? Yes, it is. Why? Because if mobilization is happening particularly through partners or colleagues we work with, we really have to make sure that there's this positive perception of the other individuals, so that you see the ability regardless of you see the potential, the capacities regardless of the existing challenges, and that also at the same time persons with disabilities don't also marginalize themselves, and they know that all of our programs are open and flexible to include any individual, not only persons with coming from any marginalized or not marginalized group. So what is again important is that not only what is it that we offer, but how do we do things, and what is the perception that we are projecting? Are we open and flexible, or are we looking into only specific groups? At the community level, we also make sure that our communication tools and materials also consider specific needs related to persons with disabilities. What else would I want to say at the community level? Of course, I mean, in terms of, we do have mobile activities to access persons who are unable to come to our centers. We have a particular project called Solidarity Initiatives, where we provide small funds to communities to implement activities on their own, and having persons with disabilities as one of the groups who need to benefit from this project is core for us. We also make sure that we conduct a lot of trainings, particularly to UNHCR staff and partners on disability and inclusion related issues. A few good examples from the Lebanon operation, if I can mention. Again, as I said, our reception centers and all our social development centers, a few years ago, we did a complete assessment to assess in terms of accessibility, if they were accessible for persons with disabilities. Our assessment at the time said that 80% they were, but there were a lot of improvements needed to be done. So we did all of them. We have the disability and older age working group, where all the agencies who are supporting Syrian refugees and beyond, they come into this fora to discuss challenges and also way forward. And we thank them very much for their technical expertise in guiding us. We have conducted with the local NGO particular projects for persons with visual impairments together with AUB. This was 2 years ago, where they were a group of young youth. They basically received some sort of vocational training and created a support group and network. Unfortunately, now because of COVID and the situation, these initiatives are happening online, but I mean, it's not the same when people come together. In Lebanon also, there are 28 public schools supported through international funding that are inclusive for children with disabilities. And again, I mean, this should be 100% of the schools should be inclusive. But I mean, as you know, our public structures, they are facing a lot of challenges.
Thank you so much, Ms. Kevorkian. If you could wrap up so we could enter into the Q&A, that would be great. Thank you so much.
Sure, sorry. Just a final note, on a final note to say that it is extremely important that we move forward with the development of the national strategy for persons with disabilities, so that whatever funds is coming in, it's going towards a common vision, and then there's a baseline where we're starting from. At least we can measure the achievements, and if we are failing, at least that everyone is held accountable. And yeah, over to you.
Thank you so much for your insightful presentation. I know there is not enough time in the world to reduce everything the UNHCR does to 15 minutes, but thank you for doing your best to do that for us. We have a few questions from our attendees. Our first question is directed at both speakers, whichever of you would like to start first. What can be done to assist the disabled quickly other than a referral system? These systems usually take time to respond, and during the waiting time for this referral, the disabled community or the community in question becomes more vulnerable while they're waiting for actual actions to take place. So how would you recommend immediate action in that regard?
I think what has to happen is that if persons with disabilities, they know exactly where to go and how to access service without the need for someone to interfere and refer, and you know, that would be really good. Another thing is that we need to reinforce our classification of the referral mechanism, meaning if someone is at heightened risk, the referral should happen, I don't know, within a period of 2-3 days. Action should be taken within a period of 1 week, and there should be proper monitoring. The problem is that sometimes some of the requests are, like, for example, if there is a request that I want to be resettled tomorrow to the United States, that's not possible. Or if there is a request that, I don't know, I need to receive assistance here and now, right now, yes, there are emergency cash that can be provided for certain cases, but then if we look at something long-term, there are also processes that assessment should be conducted, and so that we make sure that, you know, the right person is being assisted at the right time. So I think from one side, we need to enhance our accountability mechanisms, and from the other side, if persons with disabilities know exactly where to go, all this burden of waiting and referring and over-referring should be reduced.
Thank you so much. Dr. Kumbas, would you like to respond to that question or have anything to add?
Well, just very briefly, because I'm not an expert at all on this type of, you know, referral issues, but building on what Rita said, I think to me this also goes to the idea of, you know, looking at capacities, looking at you know, skill sets, because the more you can empower you know, Syrian refugees in general with information about, you know, what's available, and also with strong networks. For example, 2 Lebanese organizations of people with disabilities, that also might be a quick way for them to get to resources from people who have experience doing this. Now, obviously, you know, some things are going to be specific to refugees, you know, some channels, some resources are going to be specific to them. But I think the more you can grow the kind of, you know, what I was talking about in the presentation, peer support networks, where people can in daily life get what they need and, you know, exchange what they need and also help others. I think, you know, that's also an interesting channel in addition to improving the institutional ones.
Thank you so much. Thank you so much. A question for you, Dr. Kumbas, actually. The question illustrates a very specific case of intersectionality that you referred to. How would you operate effectively amid a national system that's unequipped, as both of you made clear, as well as an international framework that currently lacks an intersectional approach when it comes to governing particular individuals? So if we're talking about a woman with disabilities who happens to be part of the refugee community, is a refugee in the country, she's essentially governed by maybe 3 different treaties, 3 different conventions. The national framework does not reflect this intersection. So what do you recommend in a case like this? And in what direction do you think intersectionality is going in governing these individuals?
Well, I think at the level of, you know, if we're talking about the level of laws and principles, I do think the international human rights framework is actually a really good access point, because first of all, states can't turn against it and say, oh no, you know, I'm choosing and picking and choosing. So basically, you know, if you look at UN human rights treaties, you've got, you know, human rights treaties for the rights of women, you've got human rights treaties for the rights of people with disabilities, etc. So you might feel they're separate, but actually consistently the UN human rights framework over the years, sorry. Yeah, sorry. I think there was someone coming in on the call. Can you hear me?
I'm so sorry. There seems to be someone that hacked into the call. I'll try and mute them. Please continue.
That's okay. So basically, at the level of principles, if the worry of the question was the international legal framework, I actually think the international human rights framework is a very good entry point, and I think it lends itself extremely well to intersectionality. And if you look at, you know, soft law and norms that different UN human rights committees have produced over the years, they have really put an emphasis on exactly this. So I think in terms of norms and laws, international human rights framework is a really good starting point that you can also push states with, because they can't really push back against it as a matter of principle. Now, obviously, the national level is a very different story. I would say the more you can mainstream intersectionality into activism and advocacy for disability rights, obviously the greater your chances of having the state do anything about it, because right now it's not even doing enough on disability, period. So if you wanted to do something for a Syrian woman with disabilities, then you need to have this built into your own advocacy. And also, obviously, this means you need to have these voices represented in your advocacy and listened to. So I think it's also about how you build up the advocacy. I hope this answers the question, but I'm happy to build on that if there's more.
Of course, thank you so much, Dr. Kambaz. A question for you, Ms. Kevorkian, about the work of UNHCR and to what extent COVID-19 has affected your work on persons with disabilities in the refugee community, if it has at all.
Well, COVID-19 affected, I can't say no. At the level of individual support, we have had less contacts, at least face-to-face, with our persons of concern. We've been trying to provide support through phone, through WhatsApp, but I mean, as you know, if refugees, if they don't manage to charge their phones, then there's no way to contact them. So it has been very, very challenging. For some high-risk cases, we made sure that with proper health precautions, we did the face-to-face intervention, but again, it wasn't easy. In terms of activities, still the activities did not resume in groups. So what we're doing, again, we're creating WhatsApp groups for all the, if you want, support groups for all the group activities. But again, face-to-face is always very, very difficult. The other thing is what bothers even more is that because of the economic situation, you know, persons with disabilities have been very much affected by this. We're trying as much as possible to make sure that they get the assistance they need in terms of financial assistance, but the situation is very, very challenging on the ground.
And Dr. Kambaz, to a large extent, has this also affected your maybe update on your study? Are you currently working on updating the study with recent figures? A few of our listeners are actually asking whether or not your study will have a follow-up and in what direction you'd like to take the study.
Yeah, thanks for the questions. Well, unfortunately, at the moment, I have not been asked to update the study. So I was really delighted to be invited to your conference because it basically gave me a chance to have a look at what's been published since 2018 to see, you know, if there was any new data that I could add into the presentation. And I saw there was one question on Zoom now about this as well. So, you know, is there any more recent data? Well, this is what I've presented. So basically, let me, if I'm allowed, let me share my screen just another time. So the key new references that I found, I don't know if you can see my screen that I'm sharing.
At the moment, maybe we can see you, but not your screen.
Okay, so
yes, there we go.
Okay, great. So yeah, so I added references. So the reports I did was commissioned by TIFID in 2018, and so there hasn't actually, and which is a bit sad, there hasn't been much done since then. At least in terms of publication. I saw in the questions on Zoom that someone was saying, you know, some NGOs are working on this, and I do believe they are, but just in terms of publications that they have put out and data that they have shared, there's still fairly little. So the main new publications I found in English were, you know, the annual UN assessment of, you know, vulnerability of Syrian refugees from this year. And then one study, a set of studies by Australian Aid and 2 other institutions that I also warmly recommend. So if you want to look at the links, it's all public. And then I would also, as I mentioned, really recommend, you know, some toolkits that were done by the Women's Refugee Commission and Save the Children in partnership with Lebanese and Syrian organizations and individuals. But in terms of new data, unfortunately, this is what I could find. And unfortunately, I've not been asked to do any, you know, updated study on this. So I'm at the moment, unfortunately, I'm not working on this. I would really love to, but and as the people asking the questions are probably suggesting, I agree. This would be really important to do. So I hope someone gets around to doing that.
May I ask the floor just for 1 minute?
Yes, of course.
Yes, because I saw a question, someone is asking if UNHCR is going to continue education support for next year.
Precisely.
Why shouldn't we continue? I mean, we have funding related challenges, yes, but we cannot step back from education programming, particularly for refugee children, together with UNICEF, of course, as the lead. Just if you allow me, I see in the attendees, we have with us Silvana Lais, who is basically the president of the Lebanese Physically Handicapped Union organization. She's one of the icons when it comes to disability programming, well-known in Lebanon. I mean, if there's any possibility, if there's anything that also Silvana wants to say in the name of, I mean, the particular NGOs working on disability, etc., I think it would be really good. No, we didn't lose her. Yes, she's also asking to say something.
Yes,
so
we have her there. Yes, Ms. Lais, I'm going to allow her to speak maybe for a concluding remark.
Please.
Of course. Ms. Lais, are you with us?
Yes, yes, thank you.
Thank you for being here.
Thank you for this great event, because we need it. I would like to say that, sorry. Sorry. I would like to say that now maybe it's the moment to try and make a move towards decision makers to increase the level of collaboration and to really try to include refugees with disabilities within the upcoming, I don't know, strategy or national plans that we hear about. I know that we, with other DPOs, have been working with ILO and UNICEF to develop a social protection position paper for DPOs in Lebanon. But this one is purely for unfortunately, the Lebanese one. But I think we need to push forward for a similar one for including whether Syrian or Palestinian refugees, because despite of the great work that have been done by many of you, yet the gaps are still very, very big and too many. Even for the Lebanese people with disability, situation is really sad, mainly after COVID-19. So we need to try and give more contribution to try and bring people together and develop such a strategy, or at least a position paper, and try to reach now the dialogue that is going on among the donors and the government, like the World Bank and the IMF and the EU, maybe, to try and really give it a positive push to ensure that whether health or education or employment or livelihoods tools are provided. We cannot continue like that. It's really, in the field, there are many people suffering despite all. Again, I really appreciate what has been done by UNHCR and many international organizations, local and international. Still, we have big gaps, but now is the moment to do this. So I suggest if we can, from this meeting, try to start such process and go forward to do this.
Thank you so much. Thank you so much, Ms. Lais. I'm so sorry. I wish we had more time.
Thank you.
We would need to wrap up this session. Thank you so much for your valuable input and for wrapping up the talk for us. I'd like to thank everyone who attended and thank our speakers. For everyone that wants to revert back to the webinar, the link will be shared with everyone who registered, and it will be available on our YouTube channel as well. And for everyone that typed comments in the Q&A sections, we will be sure to revert them to both speakers. We are simply running out of time. But thank you once again for your time, and I hope to see everyone at the next webinar. Have a nice day. Thank you.